I call the member for South West Coast.
My question is to the Minister for Health. Yesterday in question time, in response to the member for Lowan, the Premier said, "I will tell you what we will give local hospital boards and their communities, more say," claiming that local people on boards are making decisions about their hospitals. So why has the Minister appointed 6 people from outside the area to the 9-person board of Portland District Health without taking any advice from the board?
Order, 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 order. Without interjections. Order. Order. And the House comes to order. I call the Minister. Order. 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 The member for South West Coast and the Premier. The Minister for Health has the call.
So, given that the honourable member touched on the Premier's comments yesterday, what this government does is it doesn't sack boards, it doesn't close hospitals. What this government does is it works with local communities to build better public health services. It actually returns regional public health services to the public, as the member for Mildura would testify. What this government does is invests in new and expanded public health services, as the member for Murray Plains would testify to, for the significant investment being made by state and Commonwealth governments in his local public hospital. What this government does is work with regional communities to improve and to learn and to collaborate and deliver better outcomes for their health communities. Now, in regards to the Portland Health Service is so vital to the deliberations and the public health outcomes of that community in south-western Victoria. And the very truthful point is there has been resignations from that board in recent times. And those people have been filled through processes involving local community input. 4 of the 9 directors, 44, live either permanently or temporarily in the Portland or surrounding communities. 5 of the 9 directors live in the Barwon Southwest region. 7 of the 9 directors, live in regional Victoria. They reflect Victoria's important needs, and I look forward to working with that board, as indeed I look forward to working with all our important regional health boards to deliver improved public health services and to not close down hospitals, sack nurses, sack doctors and gut public health in the regions.
Order. Member South West Coast on a supplementary.
The Portland community is fearful that the government has appointed people from outside the community to the hospital board, so they will follow the government's agenda and merge Portland District Health with South West Healthcare. Will the minister categorically rule out merging Portland District Health with another health service?
Call it. Order. I call the Minister for Health.
It's on Warrnambool Health. This is a government that funded the massive expansion of Warrnambool Health. And very, very important too, because that population is booming. And I've had very good discussions with the leadership, including the board chair and the CEO of that hospital, because they are thorough professionals and going on.
Order. The member for South West Coast.
Order.
Ask the member to resume his seat. Order. Can I ask members not to shout across the table? The Leader of the Nationals on a point of order.
On the point of order of relevance, Speaker, the Minister has a very simple question in front of him. Will he rule out merging Portland Hospital with any other health service? Yes or no? It's a very simple question. Can you please bring him back to actually answering that question?
The Minister is being relevant to the question that's been asked. The Minister.
So it may come as a shock to those opposite, those who, when they were in government, let public health in the regions be gutted, who closed hospitals. Under the Health Services Act, The minister
Order.
has
Further
no
point of
power
order.
to...
The minister will resume his seat. Order. The minister will resume his seat. Order. Order. The member for Euroa on a point of order.
Speaker, the Minister well knows the forms of the House and he knows that question time is not an opportunity to attack the opposition. He had started straying in that direction and I ask that you bring him back to the subject
Order. The
matter, which was a clear yes or no answer.
Thank you. Thank you for the point of order. The minister did refer to the actions of a previous government, which is appropriate, but I ask him to come to answering the question.
I was asked to rule out something that I have no power under the legislative provisions of this House to do. These decisions are not made by the Minister of the day. They are not made by the government of the day. They are determined by health boards and the health department under legislation written by them.
Order. Order.
And that was their deal.
Order.
So seriously,
Order. The minister's time. The minister's answer is concluded.